PETROS stands for Percutaneous Transcatheter Release of Stuck Mechanical Leaflet. It's an emerging bailout structural heart intervention used to mechanically mobilize jammed prosthetic wall leaflets caused by acute thrombosis or pannus formation. The standard Class 1 recommendation for obstructive mechanical wall thrombosis is emergency surgery or an ultra-slow infusion of fibrinolytics like alteplase. However, management gets complicated when a patient presents with high STS score, absolute contraindications to thrombolysis, or when fibrinolysis simply fails. PETROS offers a percutaneous alternative for these exact scenarios, potentially sparing the patient from a high-risk redo stenotomy. Given the shift towards lifetime management strategies for heart valves rather than binary surgical choices, it is becoming a fascinating tool to keep in the structural intervention arsenal. The technique relies on applying direct mechanical force to free the hinge mechanism. Because mobilizing the thrombus carries a massive stroke risk, deploying cerebral embolic protection device is a mandatory first step. A stiff guide wire, often a 0.014-inch coronary wire, is carefully threaded through the valve orifice, typically between the stuck leaflet and the surgical ring, for a bi-leaflet valve. Sequential balloon inflation, starting with small non-compliant coronary balloons and scaling up to peripheral balloons if necessary, are used to pry the leaflet open and restore normal closing and opening angles. While isolated case reports have appeared over the last few years, the most substantial recent data comes out of the Madras Medical Mission in Chennai. A 2024 study published in Circulation Cardiovascular Interventions tracked 24 patients who underwent PETROS with cerebral embolic protection for stuck mitral mechanical valves. Technical success was high, achieved in about 92% of the procedures with a rapid drop in transvalvular gradients. Embolization remains the biggest threat even with cerebral embolic protection devices, since the vertebral arteries are often unprotected. The Chennai study reported a 4% stroke rate and about 17% recurrence rate of the stuck valve within the midterm follow-up period. If a leaflet becomes restuck, repeat PETROS or a return to fibrinolysis are the primary management options. A demo of the procedure with fluoroscopic clips is available on X account of @Dr. Rajesh MAMC